Moving on to our last panel discussion for the day, building a patient-centric healthcare ecosystem in the kingdom. I'd like to introduce our eminent members, starting with our respected moderator. Moderator will be Dr. Poonam Gupta, Head of Quality Improvement, Hamad Medical Corporation, and Licensing Inspector, Ministry of Public Health, Qatar. Dr. Mahmoud Elbarbary, General Director, Al-Nas Hospital. Dr. Muhammad Jamil, Director, Tele-ICU Program, King Faisal Hospital and Research Center, Riyadh, Saudi Arabia. Dr. James Laughton, Head of Clinical Governance, Risk Management and Quality Improvement, Ahmad Medical Corporation Ambulance Service Group. Dr. Rayyan Alyahya, Senior House Officer, NICU, CQI, and PS Officer, Prince Sultan Military Medical City, Kingdom of Saudi Arabia. Dr. Ahmed Elsheikh, Director of Quality and Patient Safety Security Forces Hospital, Makkah, Saudi Arabia. Ms. Fadwa Abu Mustafa, Head of Quality Management, King Faisal Specialist Hospital and Research Center, Kingdom of Saudi Arabia. Now, I hand over the stage to Dr. Poonam to start the panel discussion on building a patient-centric healthcare ecosystem in the kingdom.
Thank you so much, Sipesh. Thank you. A very good afternoon to all. And we are so grateful to be here on this platform today with all the eminent speakers we have for today's panel. A very warm welcome to this Healthcare Technology Summit. And thank you so much for the introduction. I'll be serving as your moderator today. So before we start this session, where we are going to talk about how we are going to create a patient-centered healthcare ecosystem in the kingdom and how technology can support this initiative. Before that, I just want to make some points, like this is really a very timely topic in today's context. When Institute of Medicine, they have incorporated 6 aims for best quality, to provide the best healthcare quality, and patient-centered care is one of those 6 aims, which is safe, effective, timely, efficient, equitable, and patient-centered. And this is such a powerful framework to provide the best quality of care to our patients. So whenever I hear this word, the patient-centric care, there is one very famous saying which comes into my mind, like there is no decision about me without me. So nowadays, patients, they are very well aware of their healthcare conditions. They are trained how to use the technology. And most of the time, the first time when patients are getting the healthcare access, it might be through a chatbot rather than directly going to the provider and meeting them. So this is the need of the hour to collaborate between different stakeholders in the system and then work together to provide a holistic approach of care. With this, I would like to start with our panel discussion with all of our distinguished panel. So I would like to start with Dr. Rayyan. Very good afternoon, Dr. Rayyan. And as already you heard that he's Senior Officer, NICU and Patient Safety CQI Officer in Prince Sultan Military Medical City. He has a very deep interest in digital transformation, artificial intelligence, and the patient-centric care practices. So my first question to you, Doctor, where to start? If we are talking about patient centricity, where to start? Can you please guide us?
Okay, thank you, Dr. Gupta. Can you hear me well?
Yeah.
Okay, good. First, I'd like to thank the Rendezvous Group for arranging such an enlightening summit and for having me with such an esteemed panelship. First, I think the most important part is to have an accurate definition of what patient centricity means for us to be able to move on forward. There was a study done by AstraZeneca that was titled Defining Patient Centricity with Patients for Patients and Caregivers. Within the study, they identified 5 themes of importance when it comes to defining what patient centricity is. The first one is inclusiveness, and there's sharing goals that are patient and family centered. Empowering patients to take control of their own health is the third. Working in a way that shows respect, compassion, and openness, and working in partnership. And basically, to boil down these themes of importance into a few objectives, I've come up with 3 objectives or visions that can be implemented in the development of the new infrastructure of healthcare, patient-centric healthcare in Saudi Arabia. The first objective is to turn patients from informed to involved. This begins with ensuring that the patient remains updated about their health at all times. But as we move on from an age of information to an age of intelligence, we cannot afford to stop merely at informing patients about their health condition and take decision on their behalf. A provider, for instance, needs to go beyond merely just telling the patients they need to lose weight. Rather, they should come up with videos and curated content on the hows and whys of losing weight. Physical exercises that would work best for them, among other things. Patients need coaching, and only then they can truly embark on a journey of decision-making or shared decision-making. The second objective or vision is to pay attention to minute patient preferences. Our healthcare system also needs to make the process of patient feedback a standardized process. In every other industry, the main pillar, or one of the main pillars of continuous improvement, is to implement a good feedback system. However, in the healthcare industry, it is not really that focused on. So I think this is one of the things that need to be thoroughly developed from the ground up to actually improve the continuity of healthcare and telehealth. The third objective is to make outreach process streamlined. Healthcare leadership urgently needs to streamline their patient outreach mechanisms. It is frankly unrealistic to assume that an email or an SMS can ensure a zero no-show. However, organizations need to have multi-channel outreach system in place so they can reach out to their patients and their caregivers and family through SMS, emails, calls, or app notifications simultaneously, or according to the specific needs of the patient. And with that, I would like to just extend a question to the rest of the panelists. I'm just curious to know what does patient centricity mean to them, and how would they define it personally?
Yeah, thank you. Thank you so much. I think this was really very interesting and insightful, what you have put in your words, like how patient centricity should look like. So let's move forward with our second panelist, Dr. James. And as you already heard that he is Head of Clinical Governance, Risk Management, Quality Improvement in Ambulance Service in HMC. He has a deep interest in the use of model for improvement and statistical process control, organizational excellence performance, and actively involved in coaching teams at all the level. And he has a strong support for creating just culture in the healthcare facilities. I think he's a perfect combination when we talk about having the clinical experience as well as the quality improvement. So, Dr. James, my question for you, because I know that you are a follower of Dr. Deming's teaching, and do you believe that there are some of the principles that we can use from Dr. Deming's teaching so that we can build a patient-centric healthcare ecosystem? There is some connection between two?
Of course there is, and thank you very much. Good to see everybody. Thank you for the invitation. It's great to be here. And really my first point is, who was Dr. Deming? I hope most of you know who Deming was, or maybe still is. But briefly, he was an American statistician, and I can never say that word, so apologies. He dealt with statistics, was a major influence in quality improvement, PDSA cycles, and statistical process control charts. Hence, that's why I'm a big fan. And many of us would probably not realize he had a big influence on Japan after World War II. And prior to that, Japan was not well known for the quality of its products. But after World War II, they focused on the teachings of Dr. Deming and others and became a real powerhouse. So how on earth does that relate to patient centricity? I'm asking my own question. Well, the first thing to say about Deming is he would very much say, look at the system. None of this is working in isolation, and the system will be healthcare, the patients, those who are providing support, so vendors, manufacturers, pharmaceutical companies. So it's a big system, but really it's trying to deliver care to the patient. And if I was to take what is Deming's key principle, how do we define quality and value? Well, we have our own views, but Deming would really encourage us to actually listen to the patient. What is it they see as the quality and value of the healthcare they are receiving? We have our own mind, we have our own key performance indicators, but are they really relevant to the patient? And I just want to share an example with you. And I'm sure most of us have heard of, well, I certainly have, most of you have heard of the Virginia Mason healthcare system in the US. And I remember reading this story, how they were looking to refurbish a floor in a building as their oncology suite. And so it initially started off as all of the healthcare professionals were going to design it. And then somebody said, hold on a second. Why don't we just get the perspective from the patients? Because at the moment, the patient comes into the center and they walk around so many different offices and buildings and departments. But this is oncology. These patients are tired. They've usually got family with them. So what Virginia Mason did was said, okay, let's ask the patients, what is it you want? What is it you value when you come to an oncology clinic for blood tests, for chemotherapy, consultations? And typically, who gets the nicest offices? Hands up, I like a nice office too. But they really focused on, why don't we go to the patient? Let's bring them in, have somewhere for them just to come. Their family can sit with them. It's all comfortable and all of the services come to them. So that very much for me exemplifies what it is to start thinking about the patient and healthcare delivered with that mindset of patient centricity. And it will differ for a lot of them, but if we involve them and engage them, we'll hopefully understand what's important to them. Thank you.
Yeah, thank you so much, Dr. James. Like, this is really a new, insightful thing to know, to learn from you, like how everything is interconnected, like we cannot separate the things. So that's so nice of explanation. That was really great. So let's move towards our next panelist, Dr. Ahmed. So I would like to welcome you, Dr. Ahmed. A very good afternoon. Dr. Ahmed is Director of Quality and Patient Safety at Security Forces Hospital, and he has extensive experience in the field of quality improvement, patient safety. He is Director, Surveyor, author of many published resources, and international speaker. So, Dr. Ahmed, my question for you, because you are a multinational healthcare surveyor and the expert. So, and we know that like in quality, whenever we talk, our first prioritization is on the standardization. So how can, how the process standardization can help us establishing a patient-centric health framework? So can we do that? Is it feasible?
Oh, thank you so much, our moderator, and thanks to my dear colleagues and experts who really established that telehealth is different. We're talking about a different concept of telehealth, especially when we talk about the patient-centeredness from the centricity itself and Deming. I believe that the most important or the cornerstone of this is the process standardization. And we can address this on two levels, the macro and the micro level. Yes, you can deal with the telehealth just like the modern health, and most probably you're going to fail. Because what we learned from COVID pandemic was an accelerator. It gave the telehealth a push that it had never dreamed of. And we can say that from governmental level and from organizational level, we found ourselves more or less in front of the status quo. We should handle it. But look at what we have right now, moving from the 2020 until the 2022. Right now, we have the regulations in place. We have the telehealth regulations by the Saudi Health Council that was published in October 2020. And we have the settlement of the Saudi Telehealth Network, the STN, which was a very important milestone. We have as well legal regulation that was freshly updated only 3 months ago from the MOH regarding the legal regulations of the telehealth services. In other contexts, the Saudi standards for human-centered care, it was published just 6 months ago, early this year. Now we're looking at the blend of these. Had to have the process standardization in place, to have the standards in place, and as well, not only regarding the regular practice, but as well as the patient-centeredness care. In fact, you will not find this line clearly there. You should look for it and you should blend it. And remember every time that these standards were mainly, especially the operational standards, were mainly directed toward the face-to-face care. The human-centered care standards as well, despite it being a piece of art, it didn't touch the telehealth directly. So now it's your part to make sure that you consider the telehealth patients as part of your patients and to enlarge your umbrella in order to cover all of them, not only the current patients. Yes, you will find some challenges, just as especially the ancillary services challenges regarding the lab, the imaging, the medications, things that we have was wasfati in place in Saudi. But by the end of the day, you should do your own, not only on the macro level, but on the micro level as well. I forgot to mention that Sibahi, the 4th edition, is mentioning the telehealth clearly and focusing on the credentials. Now it's your turn to blend this and to move forward to your current process standardization. Consider the telehealth as an eminent part of your business, and this will help you, this blend will help you to move forward.
Thank you so much, Dr. Ahmed. It was really, yes, standardization is the key, and as healthcare professionals and basically the quality improvement professionals, we should put a focus on that. So that was really great to learn from you. But in the same like domain, I would like to ask you, we are talking about telehealth and patient-centric care, but do you think so there are some patient safety risks if you are going to adopt the system or all? Do you think so?
Definitely, definitely. This is a very important point that we should have a clear highlight and focus on. And this is very important. Yes, we're doing telehealth for the sake of the patient, but never forget that this may come with a cost. The bright side of telehealth for patient safety, especially, it took us into depths of focus of the patient credentials to practice such services. We had started to have clear delineation of authority for the physical and telehealth. And when we designed the patient-centeredness approach, it improved the accessibility and enhanced the patient compliance. Yes, we have some research that says that patient compliance was posted by the telehealth. Yeah, the medication compliance, the medication error reduced, but this came with a cost. If you look at the literature, there are very important papers that was published between 2014 until now that studies these type of risks. I'd like just to summarize it and wrap it up. There are some related to the tasks and practices itself. They say with a very strong evidence that less face-to-face contact led to hinder the clinical practice, and lack of in-person was considered risky, not only in ER cases, but also in perceived acute cases. The person-centered care and characteristics and capabilities itself, and to a lesser extent, the problems with technology and device. And I believe if we repeat it now, I believe this barrier is going to be lesser a lot because of the impact of COVID. We became very familiar with this. In order to enhance this, let's again shine the bright side that we reduce the patient motion, we deliver the care, reduce the exposure of the patient, he receives the care at home. But again, we should look at some specific unique challenges such as elimination of fraud, the patient identification, and so on. This shall be hand in hand with the process standardization of the patient safety, and we believe that this is going to get mature very soon because the demand is very high, and inshallah the healthcare is going to cope with this.
Yeah, thank you, Dr. Ahmed. Yes, I do agree with you. Yeah, there are positive things, but we need to keep an eye on some of the disadvantages, some of the challenges, but that is not something which cannot be tackled if we are careful. So definitely, thank you so much for highlighting those challenges, and this is really a great learning. Now, I would like to move to my next panelist, Ms. Padwa. She's good afternoon, Ms. Padwa. She's Head of Quality at King Faisal Specialist Hospital and Research Center, and she has 30 years of vast experience in various clinical, post, quality, and leadership positions. She has published her work intensively and received many awards. So, like we are really, it's our pleasure to have you on board, Ms. Padwa. My question to you, nowadays we are seeing there is rise in trend of incidence and prevalences of chronic diseases, and yeah, we do give credit to the sedentary lifestyle. Basically, these are the lifestyle diseases. So, do you think so? We can get some benefit from the current move when we are moving towards e-health services. So the hospitals they can get some benefit in the treatment of chronic diseases. For example, such as diabetes. So is there any connection between these two?
Yeah. First, thank you very much. Are you able to hear me well? Okay, great. So thank you very much for my colleagues for this great insight really about very important topic. I would like first to start from the insight that my colleague Rayyan gave, or Dr. Rayyan gave in relation to Centric care. And our organization, I like our general manager referring, when he refers to the patients as a king in our organization. And this is just shows how much we are thinking about the centric care providing for the patient. Everything that's being provided to the patient should be really aligned, linked, and done in a manner where it will engage, satisfy, and also involve this king within our healthcare organizations. Now, we need, as mentioned by Dr. Rayyan, also to benefit from the advancement in technology by having the telehealth, having the virtual care in healthcare sector. It's going to take a journey really to reach to a destination with continuous improvement over time in order to deliver the services. However, our organizations nowadays consider focusing on three domains, you know, in healthcare, which is first efficiency, second outcome of the care itself, and third engagement and satisfaction of the patients. And when we look at these three domains, we found telehealth will be able to afford really value in the three domains. We are looking into continuous engagement of the patients, especially if they are far away from the healthcare institutions. We would like really to be able to interact with them more frequently, provide them with the education, provide them with the continuous monitoring that's possible for their cases, especially for patients who are suffering from something like diabetes. And the other area again is looking into the domain of efficiency. We are trying as much as possible to give more, provide more for our patients, but considering the cost. So if we are implementing more and more of telehealth and virtual care and done it in a manner where we will be able to control the resources that goes around, you know, the delivered care, we will be able also to achieve more with less. We have really seen an excellent models implemented in our hospital and other hospitals throughout the world, where virtual care has been provided with added value for several contexts, you know, caring for women who are delivering, caring again for patients with chronic diseases. And it did really reduce the cost of running those services, and the cost goes with all aspects, manpower, and also visits to the clinics. And just to also mention here, we are not considering only the cost at the level of the healthcare organization. Considering the cost at the level of a patient is also important aspect.
Yeah.
And we have seen really a very good results on this area as well.
Thank you so much sharing your experiences. Definitely we need to take care of the cost on the patient pocket, how much it is. At the same time we need to look for the healthcare providers, and this is really a perfect balance what we are talking. So thank you so much, Fadwa, for your insights. I would like to move to our next panelist, Dr. Mouhamad, who is the Director of Tele-ICU program at King Faisal Hospital and Research Center. He's a board-certified pulmonary critical care and sleep medicine consultant and active member of many medical societies. And due to his extensive or intensive interest in e-health, he has established the first telehealth ICU program in Middle East. So welcome, Doctor, and we are really, it's our privilege to have you on board. My question to you, because now during COVID, we have learned a lot of things, and our previous panelists, they have put this, they have also emphasized on the fact that telehealth, it has achieved a new heights during COVID. So can you just share your experience, right? Like what is the specific role of telehealth and telemedicine during COVID and post-COVID? Because we know that no time soon we are going back to the pre-COVID status quo. So can you please explain and share some examples?
Okay, thank you so much. First of all, it's an honor to be with a great panelist and also the audience. Let me start just to clarify for a lot of people, they mix. Telehealth not coming to replace a bedside physician. There is a role for each one and in different way. Number one, telehealth started years before COVID. And the only positive thing that's COVID did to us, that's make a lot of administration and government to work faster to improve the telehealth. But telehealth, when I started, telehealth was back in 2004. It was at that time, a lot of people still knowing the project. Now, what's good about it, same thing when electronic medical record came to life, a lot of people, they resisted. And I remember a lot of people, they quit practicing medicine because they said, I'm not going to work behind the computer, I'm coming to see a patient. And now if we work in the hospital, we cannot work as a system drop down for a few minutes, everybody get paralyzed. So this is fact that we need to know. Now, I was working on projects, same care everywhere. People, they need to know, whoever resisting telehealth, that there is a lot of subspecialists and a lot of things that can be helping the patient throughout in rural area and including the city. We cannot have a lot of specialty in every hospital. You might need them from place to place. There is a lot of telehealth, but when we talk about telehealth, we're talking about teleradiology, we're talking about telepathology, now telesurgery, and the list go on and on. The technology is here. And as I said, helping the patient, we're not talking about helping patient from medical standpoint. A lot of people, they think, my patient gonna come to my clinic, I'm gonna examine him, how is gonna happen? I will tell you my experience. I've been practicing for more than 30 years. People, they like to see their doctor to tell them you're doing great. It's their mental health. And we are forgetting this very essential thing. When I was able to have an access to my physician, whenever the area, it will be helpful. Second, we're talking about cost. When somebody gonna travel for 3-4 hours to take a flight to come to a major city and have to take a vacation from his work, airline, the risk of travel, have to take family member with him. This is also need to be put in the cost of telehealth. Now, what about medically? Medically is definitely, I saw so much benefit from telehealth for the care of patient. As I said, sometimes the subspecialist is not always available everywhere. And we can help those patients, provide them the best health care wherever they live. And I believe we are in 2022 in this, with all this technology, I don't see any patient deserve to have less care from a tertiary hospital. I think just I tried to put in a summary, just I'm passionate about it. And
yeah, thank you so much. Yeah, we can feel that. That was really a great discussion, and there are many things to learn from it. I'll get back to you for more questions, Doctor. Let me introduce our last panelist, Dr. Mahmoud. He's General Director of Al-Nas Hospital, and he's having vast experience and interest in driving a culture of innovation in healthcare through value-based model. Under his leadership, Al-Nas Hospital has opened multiple new facilities. He's nationally and internationally recognized healthcare leader. So we have now we have gone, like our panelists, they have gave us some detailed insight about how this telehealth work for the patient-centric healthcare ecosystem. And we know that without data, we cannot prove ourselves, right? We need data for everything. So my question is same to you, Dr. Mahmoud, like how to use the data, whatever we are getting from this ecosystem, because there will be a lot of data will be generated. So how we can differentiate this is useful and this is just a noise. So can you just give us some insight about this? You're on mute, doctor.
Okay. Do you hear me now?
Yes. No.
Yeah. Okay. Thank you to invite me to this conference. Actually, I have a different background. Like I'm intensivist and now going for administration. And also for 3 years or 4 years, I worked in IT, in cardiovascular information system. So what I get from all of this, that we should use all of tools to integrate and have the value of having the patient in the right way. Before, as a lot of my colleagues said, that the patient centricity is the most important. Actually, in the COVID era, and I used in my hospital here what I said to my colleague here, it's reverse telemedicine. While the patient is isolated in ICU or in his inpatient room, even his family or her family need to have assured about her health, and it was also important for the mental health for the patient itself, because in the isolation era in COVID, isolated patient, they have a lot of fears about their health, and they have a lot of fears about their people outside the hospital. So what I said, that the telemedicine come with us with a lot of data and a lot of important data, how we can get use from it by the end to get use them for the patient centricity. Because while I was working in the IT or the data collecting, the most important that the technology now have availability of a lot of data, but we can't get use of them because a lot of workers in the healthcare sector can't arrange them or segregate them or validate it. So this is one of the most important, how to use the data coming from the telemedicine and put it in a structured way to get use of them to have a good service for the patient. Because with time, you will have a lot of technology that transfer to you the data of the patient from his home, like vital signs or something, or his X-ray or something, but how you can get use of them in the hospital and to have opinion and transfer it again to the patient in a good way. So how we can get use from the healthcare sector personnel to, like what I said, digital transformation for the mentality of the healthcare provider to make it to make the data coming from the patient in a good way, to have analysis for this and transfer back again to the patient. We have a lot of what we said, artificial intelligence solution, and a lot of technologies that use a lot of data, but how we can get use. I think this is the future, how we can transfer it to structured data and put it in a good way to make the artificial intelligence or a doctor has an interpretation, good interpretation, and back it again with a good decision for the patient with the use of the technology of telemedicine. This is my input about this.
Yeah, that's really great to know. Yeah, we need to have the structured data, and we need to separate what is just a noise and what are the data which is helpful to improvement, for the further improvement. So in line with the same, the next question, what is the future, what future looks like for AI and the data in this field, like artificial intelligence and the big data? What is the future?
I think that the artificial intelligence solution will replace some interpretation from the doctor, because we have here in Egypt, and I think also in the kingdom, shortage in some specialty like intensive care and anesthesia. As Dr. Mouhamad said before, it will not replace the bedside medicine, but what we will do with the shortage of doctors, especially in intensive care. So what I said before, that the structured data is the primary step to get the data from the telemedicine, to put it in a structured data way, so the artificial intelligence or machine learning can replace some interpretation from the doctors. Like we have that in ecosystems, that we don't have a lot of doctors in cardiology, but we have a lot of technicians. So we use the technician to get data, and the doctor in the echo lab interprets this. So I believe in the future, with the shortage of intensive care doctors, I believe that the artificial intelligence and some solutions will help the patient to get a decision in an easy way. If the healthcare sector provider can do it in a structured way. So I think it will be, this is our future or near future.
Yes, thank you. Thank you so much, Dr. Mahmoud. And it was really a pleasure to have you on board and to listen to this insightful comments. Now, I think we have, from all of our panelists, we have learned about like how the telehealth is working and how it's important during COVID time, post-COVID time, and what is the future looks like. So again, I would like to go back to my first panelist, Dr. Rayyan. I would really like to ask you, what do you see, like what could be the Saudi Arabia's Kingdom of Saudi Arabia, their healthcare ecosystem of the future look like? So do you have a vision, or do you have any comments regarding that?
Okay. Well, if we're talking about the future, I think it's always helpful to try and dream big, right? So I think there are three layers of importance that need to be addressed when discussing the future of a healthcare ecosystem, a patient-centric healthcare ecosystem. The first one is infrastructure. The second one is intelligence. The third one is engagement. Now, let me just go through a case study of what I would imagine the patient experience would be like in the next decade, or hopefully in the next few years. Let's say there was a patient named as Mouhamad. Mouhamad is a 60-year-old patient with multiple chronic illnesses. Let's say he has hypertension and he is obese with diabetes. So the first layer that Mouhamad has to go through is the infrastructure level. There would be patient-generated, provider-generated, social, health, wellness, and financial data that is captured and curated and managed and shared across all stakeholders in healthcare for a complete view of Mouhamad's health. And then that information would go through the second layer, which is the intelligence layer, that is advanced analytics and technology. Mouhamad's care is supported by advanced analytics to service and analytics services and artificial intelligence that convert the data into actionable insight. It is not out of the realm of imagination to think that one day the AI would start suggesting next steps before the patient even realizes they have the symptoms. I mean, so far we have ads that incorporate artificial intelligence to tell you what you already want. And it's been implemented already in Apple Watches that there's fall detection, and there is also ECGs now. With time, that can only get better and better. So dreaming big and thinking that artificial intelligence could actually prevent illnesses and prevent attacks and cardiac events, for example, is not far from imagination, really. And the last step, or the last layer that I think is the most bulk of the work when it comes to healthcare, is the engagement phase. It is also useful to think, maybe there would be a digital concierge that's proactive, not reactive to the patient's needs. Previously, Mouhamad was disengaged from his healthcare. Now, Mouhamad Digital Concierge helps him stay healthy, educates him and his caregivers and his family on his condition, checks to see how he's feeling every once in a while. Going back to the what my colleague said, the mental health of the patient, that is really important as well. There could also be weekly meal deliveries for patients with very specific diets who are unable to create their own food, or who don't have a family support that creates the specific foods that they need. There could be community resource groups, automatic prior authorizations and prescription deliveries, proactive phone calls that could detect if the patient is going to expect any attacks or episodes in the next few days, that needs a proactive preventative measure that stops any unnecessary visits to the ER, transportation assistance, digital check-in, and so on. The sky is the limit really when it comes to engagement and prevention. Of course, this is just one example when it comes to chronic cases, illnesses, but I can see it being applied to all types of healthcare ecosystem, from the ICU to chronic cases to the ER, and it is really a fascinating technological world that we're opening up to.
So this is what the word it comes into my mind. Really, it's fascinating. And thank you so much for letting us understand through use of the example. And that was really nice, Dr. Rayyan, from your side. So my next question to Dr. Mouhamad, we know that there are two sides of the coin. So we have already understood and listened to the one side. Okay, this is helpful for the chronic disease, COVID, everything. But do you think so there are some disadvantage of this telehealth which might limit its expansion? Do you think so, Dr. Mouhamad?
The disadvantage, actually, we create this disadvantage. Currently now, as I mentioned, the technology is improving, but people, they might overuse the telehealth. And overusing this mean they replace the telehealth with the bedside. We need to remember the emotional part. We need to still have some physical exam. Now, looking at the recent advantage, what we have a stethoscope, we have now the vital sign, we can monitor those patients, we can play with the ventilator. But I think people who's practicing medicine, they have to remember that also the human factor need to be there. Number one. Number two, still the disadvantage of hackering and going into the system. So, and I believe there is still way to go from the IT and the company to make sure you block all this, the hackering. Now, what I know that the government, Saudi Arabia, the Ministry of Health, they are working very hard to create system that to protect the customer. And those are people that we have to worry about it, because if there is a hacker, there is a lot of problem that can happen down the road. So those are the misadvantages that we have to think about it. Now, also there is a way we have to protect the physician. If there is some medical error, which also one of our colleagues, he mentioned, telehealth actually will decrease medical error, in my belief. And this is on multiple layers using artificial intelligence. But people, they have to know artificial intelligence, it depends on us, what to program it and what data we put it. And I'll give an example. Initially, I am part of the artificial intelligence project. The data I got, it was all wrong, because initially when we insert the data and we program it, it was not accurate. So we have to be smart, and my colleagues, I'm seeing, they agree about it because they are dealing with it. So putting the data from the beginning to build the program in each hospital from the ground up, this is the key point. Because if you start building no data just to go from level 10, you're going to end up harming the patient more than benefiting patient. Thank you.
Yeah, many thanks. This was such an eye-opener, and I completely agree. We need to keep all these things in mind while using the technology. There are chances of hacking, and there are lots of issues. But this is something which can be tackled, as you said, that if we use this smartly, and we are already prepared to tackle all these issues from the beginning, from the ground. We should not act once the event happened. So I think before that, we should make some sort of this platform where it cannot be, this kind of things cannot happen. So thank you so much, Doctor, for giving this insightful comment on the disadvantage and all. So I would like, my next question, I would like to ask Ms. Padwa, from your experience, I know that you have a vast experience in this field, and you know that during COVID time, and we are having somehow everywhere in the world, it's not only at some places, somehow we are facing a shortage in the healthcare workforce, because this is highly skilled workforce is healthcare. So do you think so by using telehealth, these two things can be tackled, like these two things are interrelated, somehow this matter can be tackled by using the telehealth?
Dr. Poonam, just before Ms. Padwa starts, I just wanted to inform we are running out of time.
Okay. So I think the last one, and then I just have one small question for Dr. James, maybe 5 more minutes. Thank you.
Sure.
Okay. Yeah.
What we are looking for nowadays is really to enhance and optimize the use of resources. And manpower resources is one of the most critical, and at the same time, really COVID-19 era brought to us this issue and really showed it on the surface, not only in the Kingdom of Saudi Arabia, but really worldwide. Now, utilizing telehealth will help a lot, and I think some of my colleagues also in this session has mentioned and tapped on some of the benefits. Tertiary care hospitals with advanced physicians and also other allied health and nursing services is not really something that's available in all the corners of any country. So telehealth will help us really to connect with those talented people with other healthcare providers in different corners in the hospital. And this is something that we have seen really in Saudi Arabia successfully with programs of health outreach, we call them, where physicians who are ICU physicians sitting in Riyadh, for example, will be able to communicate with other physicians who are in another corner or part of the kingdom, explain, discuss real cases and see the patients and try to come up with care plans mutually. So yes, I think with the shortage worldwide and restrictions that's happening due to the travel of people and being able to attract international talents, we have to rely on virtual and telemedicine a lot in order to spread the experiences and try to get really benefit from what we have available nowadays in order to promote this area. Thank you.
Yeah, thank you. Yes, I do agree with you. There is a need, because we need to change with the time, and there is a need, and how much we can rely on this telehealth, and how we can tackle the upcoming issues. So thank you for sharing the insight. So my last question, Dr. James, before we close this session, only one point, what we should focus on. The closing comment, please, Dr. James, over to you.
No pressure then for the closing comment, and all eyes on the end statement. I love technology, but actually I'm going to go away from the technology, and I'm reminded of the Institute for Healthcare Improvement, and I pictured Don Berwick saying, and the question that I think there's a day every year where we ask the patient, what matters to you? I come back to really Deming as well. Let's just focus on what matters to the patient. The Virginia Mason example is a classic. There's probably lots of technology in there, but it came back to what's important to the patient, what matters to them. It may not be what's important to us. Learning from them to develop the system, building the trust they have in the system, and those providing the care. And that in a way leads me to really where I spend a lot of my time thinking, which is, respecting the people who are working in the system and the patients and everybody. And then also looking at how we can improve it together. So interestingly enough, I've kind of talked about respect for individuals and continuous improvement and systems, which very much for me is what I consider lean culture, or what originally started with Toyota production system. And if we boil it down for me, what matters to you? Our patient. Thank you.
Our
So
patient
much.
and the king.
Thank you. Yeah, that was really nice. And thank you so much, everyone. First of all the sponsors who arranged this this conference, and all our distinguished eminent panelists, and to share your great experience and insights from the vast experience in this field. So it was, I hope everyone has enjoyed and learned from this session as much as I have enjoyed. So over to you, Satish, please.
Thank you. Thank you so much, Dr. Poonam. Thank you very much, Dr. Rayyan, Alyahya, Dr. Mouhamad, Ghyath, Jamil, Dr. James Laughton, Dr. Mahmoud Elbarbary, Dr. Ahmed Elsheikh, Ms. Fadwa Abu Mustafa, and our dear panel moderator, Dr. Poonam Gupta, for an extremely interactive and insightful discussion. It is indeed great to hear about the building a patient-centric healthcare ecosystem in the kingdom. Thanks again. Moving on, I would like to remind all our dear participants to visit the booths of Philips, Advanced Care, TrueDoc, Nexus AI, and OneSource Solutions International, and see what they have to offer towards telehealth. Well, what a wonderful and power-packed day this has turned out to be. I'm sure we all have learned a lot from what we heard today on the insights, trends, solutions, predictions, experiences, and for what lies ahead. With this, dear audience, we have reached the end of day 2 of KSA Telehealth Technology Summit. I believe it was insightful and informative. The entire team of Trek's event is thankful to our eminent guest of honor, Dr. Hani Muhammad Al-Radadi, Chief Operating Officer, Seha Virtual Hospital, Ministry of Health, Kingdom of Saudi Arabia, our esteemed speakers, eminent panelists, moderators, our sponsors, Philips, Advanced Care, TrueDoc, Nexus AI, and OneSource Solutions International. Last but not the least, I thank all our delegates for joining us today in huge numbers and making this day a success. See you all soon in the next edition.
Thank you.
Thanks, Poonam. Thanks, everyone.
Thank you.
Thank you.
Thank you.
Thank you all. Thank you.